A 5 years old boy present to the clinic with short stature suggestive of achondroplasia. What is the genetic basis of this condition? So in case of achondroplasia, what type of the genetic defect? It is direct question, and we have to find here the options. Options are X-linked defect, Y-linked defect, Y-linked defect, autosomal dominant effect, and autosomal recessive effect. So what may be the option? First of all, let's see the achondroplasia. The achondroplasia, it is a common cause of the dwarfism. That means in case of achondroplasia, there is the not increase the length of the bone, and finally it is development of the achondroplasia. And what occurs? It defects in fibroblast growth factor receptor. So fibroblast growth factor receptor abnormality develop, and for this condition no growth occurs or early arrest of the growth occurs. And most of the cases, that means in the case of 70%, it is the sporadic mutation. That means only 30% is the genetic cause. And the risk factor, it is advancing parental age at the time of the conception. When that means, so when there is the age of the father and mother, usually the at the end of the time, that means the 35, 40, 45. So in this condition, there is a chance of development of the achondroplasia, and it is the autosomal dominant fashion. And keep in mind that in case of almost all type of the structural deformity, it is the dominant condition. On the other hand, the enzymatic condition or in case of the hormonal condition, usually they are recessive. So when there is the structural changes occur, this type usually dominant. When there is the hormonal change occur, when there is the enzymatic change occur, in this condition usually the recessive. What are the radiological feature? There is a large skull, narrow foramen magnum, short flattened vertebral body, narrow spinal canal, horizontal acetabular roof, and broad short metacarpal. That means all type of the bone structure usually reduce. Here we can see a person present with achondroplasia, and it is very visible that it has the short hand, short leg, and there is different type of the abnormality, and it is the structural changes. So any type of the structural changes, it is usually dominant. And other options here, such as the X-linked defect, it is not true. Y-linked defect also not true. Y-linked effect, usually this type of defect not present. And autosomal recessive, the recessive occurs in case of the enzymatic condition or enzymatic mutation, or the mutation which causes the different type of the hormone abnormality.